Hey, welcome to The Explainer. Today, we're going to dive deep into some of the unseen threats that can target our body's most critical network, the cardiovascular system. And that's a really big question, right? I mean, the heart and our blood vessels, they're the literal lifeline for our entire body. If they get compromised, everything is at risk. So let's take a closer look at what these threats actually are. So, on the surface, it sounds simple enough, right? Infections that target the heart or blood vessels. But as you're about to see, the story gets way more complicated. Where these infections hit and how they attack, well, that changes everything. All right, so to really get a handle on this, you gotta have a map of the battlefield. And we can actually break these infections down into a few key categories, which makes it a lot easier to follow. So here's our game plan. We're gonna explore four main areas. First, infections that get right inside the heart itself. Then we'll look at the blood vessels. After that, we'll talk about infections that come from medical devices. And finally, we've got a really surprising category where the body's own immune system becomes the threat. This is our roadmap for today. To make this super easy to picture, let's think of the heart as a fortress. Seriously. It's got an inner lining, it's got these thick, muscular walls, and it's even got an outer protective sac. Each one of these layers can face a really unique kind of attack. Okay, you ready? Let's breach the perimeter and explore the attacks on this fortress layer by fascinating layer. First up, we've got something called infective endocarditis. This is an infection that goes after the endocardium. That's the super smooth, slick lining on the inside of the heart's chambers, and crucially, the heart valves. The name itself is a dead giveaway. Endo means inner, so this is a direct attack on the inner sanctum of our fortress. And the real danger here is that it can mess up the delicate machinery of the heart valves, the little gates that keep blood flowing in the right direction. All right, pulling back one layer, we get to myocarditis. This infection targets the myocardium, and that's the powerful muscle tissue that makes up most of the heart. You know, the part that does all the heavy lifting, all the pumping. And just like before, the name tells you everything you need to know. Myo means muscle. So if endocarditis was an attack on the inner lining, myocarditis is a full-on assault on the fortress walls themselves. It weakens the very structure that gives the heart its power, threatening its ability to pump blood to the rest of the body. And that brings us to the final layer of defense, the outermost layer. Pericarditis is an infection or inflammation of the pericardium, which is the protective sac that the heart sits in. And sometimes this can lead to a dangerous buildup of fluid around the heart, which is known as a pericardial effusion. You guessed it, the prefix peri means around, so this is the final type of siege. It's an attack on the fortress's outer defenses. And that fluid buildup, it's bad news, because it can literally squeeze the heart, making it hard for it to beat freely. Okay, so we've covered the heart itself, the main fortress. But what about the supply lines, the highways it commands, the blood vessels, and some of the hardware that we use to get into them? First up in the vessels, we've got something with a kind of tricky name, mycotic aneurysm. Now, you hear mycotic and you think fungus, right? Well, scratch that. In this case, it just means any infection that damages and weakens a blood vessel wall, causing it to bulge out, kind of like a weak spot in a tire. Then you've got something totally different, CRBSI. That stands for catheter-related bloodstream infection. And here, the infection isn't starting from a weakness inside our body. Nope, it's coming from a medical device, like a catheter, that creates a direct doorway for germs to get right into the bloodstream. And this is a really important distinction to make, right? On one hand, you've got an infection that's attacking our body's natural anatomy, like a blood vessel wall. But on the other hand, you have an infection that basically hijacks the very tools meant to help us, using them as a bridge to get into our otherwise sterile bloodstream. All right, for our last stop on this tour, get ready for a major plot twist. So far, we've been talking about external invaders, bacteria, viruses, you name it. But what happens when the danger actually comes from within? That's right. Sometimes the most serious damage isn't caused directly by a germ infecting the heart. It's caused by our own body's powerful and sometimes totally misguided defense systems. And this brings us to something called acute rheumatic fever. This is an autoimmune-mediated condition. So what does that even mean? Well, basically your body gets confused. An initial infection, a lot of times it's just strep throat, can trick the immune system into mistakenly attacking the body's own tissues. And that can include the heart valves. So the germ isn't even in the heart, but the body's over-the-top reaction to it is what's causing all the damage. It's a case of friendly fire. So when you step back and look at the whole picture, from direct assaults on the heart's fortress to infections along its vascular highways and even friendly fire from our own immune system, it's just incredible. The cardiovascular system is a remarkably complex battlefield. It really highlights the unbelievable delicate balance required to keep our most vital engine running every single second of every single day. Welcome, everyone. Today, we're diving deep inside the human body to uncover a really sneaky and dangerous condition, one where a simple infection can launch a full-blown assault on the heart itself. Let's get right into it. So just imagine this for a second. The kind of bacteria that might get into your bloodstream from, say, a dental cleaning, what if it could travel through your body and build a fortress right inside the very organ that keeps you alive? It sounds like something out of a sci-fi movie, but it's the very real story of infective endocarditis. So, what exactly is this thing? Let's break down infective endocarditis and understand why it's such a major threat. Okay, at its core, infective endocarditis, or IE, is an invasion. It's when microbes, usually bacteria, attack the inner lining of the heart, which is called the endocardium. But here's the really crucial part. They form these things called vegetations. Now, don't picture a plant. Think of it more like a little, fragile colony. A clump of bacteria, platelets, and clotting material all balled up together. And as you'll see, that's where the real danger lies. Now, you've got to know that IE isn't just one single thing. It really has two very different personalities. On one hand, you have acute endocarditis. This is the fast and furious version, a sudden, violent attack, often from a super aggressive bug like Staph aureus. It can hit even perfectly healthy heart valves, and honestly, it has a high mortality rate. Then, on the other hand, you have subacute endocarditis. This one's the slow burn. It can simmer for weeks, even months, usually targeting heart valves that were already damaged to begin with. So you're probably wondering, how does a microbe go from just floating around in your blood to causing all this chaos in your heart? Well, it's a pretty strategic four-step invasion. First, there has to be an opportunity, some kind of tiny injury to the heart's lining that creates a rough patch. Think of it like a bit of Velcro. Second, as bacteria drift by in the bloodstream, that rough patch is the perfect place for them to stick and start a colony. Third, the body's natural response is to try and heal this spot, so it sends platelets and fibrin. But this actually backfires, creating a protective biofilm over the bacteria. That's how you get that vegetation. And finally, the most dangerous step. Pieces of this fragile vegetation can break off, sending little clumps of bacteria sailing through the bloodstream to cause damage elsewhere. All right, so who are the bad guys in this story? Let's take a look at the most wanted list of bacteria behind this siege on the heart. For people who have their own natural heart valves, public enemy number one, without a doubt, is Staphylococcus aureus. But right behind it is another major player, Viridans streptococci. And what's fascinating about this one is it's the kind of bacteria that normally lives in our mouths. It's a perfect example of how an everyday microbe can turn into a serious problem if it gets into the wrong place. But the story changes if a patient has an artificial or prosthetic heart valve. If an infection happens early on, say within a year of surgery, it's often caused by bacteria you'd find in a hospital, like S. aureus, or another group called coagulase-negative staph, or cones for short. If it happens later, the culprits start to look more like the ones from the community, but overall, for prosthetic valves, cones are the most common troublemakers. And in cases linked to IV drug use, our repeat offender Staphylococcus aureus is back on top. It's especially common in infections on the right side of the heart, which makes sense because that's the first place blood goes after returning from the body. So you can see, even though a lot of different bacteria can cause this, a few key players show up over and over again. So with such a serious infection hiding deep inside the body, how do doctors even figure it out? Well, it's like a piece of high-stakes medical detective work where they have to piece together all the clues. The investigation usually starts with some pretty general symptoms, fevers, chills, just feeling awful. A huge red flag, though, is a new heart murmur. But doctors also look for these really specific, almost old-school physical signs, tiny little clues on the body that point to this big problem inside. Things like Osler's nodes, which are these painful little bumps on the fingers and toes, or Janeway lesions, which are painless spots on your palms and soles. To really confirm it, though, doctors need the smoking gun. They rely on two major pieces of evidence. First, you gotta catch the culprit red-handed. That means getting positive blood cultures, finding the actual bacteria in the patient's blood. And second, you need visual proof. That comes from an echocardiogram, which is an ultrasound of the heart that actually shows one of those vegetations or some other damage to the heart valves. And then there's all the supporting evidence, the minor criteria. Think of this as the circumstantial evidence that builds the case. This includes things like having a heart condition that puts you at risk, running a fever, or finding evidence that tiny little clots have been traveling through the body. None of these alone proves it, but together they paint a very suspicious picture. So how do doctors put all these clues together? They actually use a specific formula to make the call. You can get a definite diagnosis if you have 2 of those major criteria, or you can get it with 1 major criterion plus 3 of the minor ones. And you can even get there with 5 of the minor criteria alone. It's a really systematic way to make sure they get the diagnosis right for such a tricky condition. Okay, so the enemy has been identified. The diagnosis is confirmed. Now it's time to launch the counterattack and fight back against this infection. The main weapon here is a long, heavy-duty course of antibiotics. We're talking 4 to 6 weeks of treatment, usually through an IV. And this is not a one-size-fits-all approach. The doctors choose the exact right antibiotic based on which bacteria they found in the blood cultures. It's a highly targeted campaign designed to completely wipe out the invaders from their fortress inside the heart. We've talked about what it is, how it starts, and how it's treated. But let's get down to the bottom line. Why is this hidden infection so incredibly dangerous? And here it is. This is the absolute key. Those vegetations, those little clumps of bacteria and platelets, they're fragile, they're crumbly, and pieces can break off, becoming tiny infected clots that get shot out into the bloodstream. If one of those lodges in an artery in the brain, you get a stroke. If it goes to the kidney or the spleen, it can cause an abscess or kill off tissue. The battle that starts in the heart can cause devastating damage all over the body. You know, the idea that harmless bacteria from our own mouths can become a life-threatening invader is just a powerful reminder of how complex our relationship with the microbial world really is. It really leaves you with a final, pretty chilling question. What other common microbes are living inside us right now, just waiting for the perfect opportunity to strike?
You know that feeling, right? That scratchy, painful sore throat that just makes everything miserable. We've all been there. But what if I told you that sometimes that very common illness could be a warning sign for something far more serious, something that could permanently damage your heart? Today, we're going to unpack how a simple sore throat can have such a dangerous hidden side.
It sounds a little crazy, doesn't it? But the answer is a definite yes, it can. There's a whole chain reaction that can start with a really common bacteria, and that's the big question we're going to tackle in this explainer.
Okay, so how on earth does a sore throat lead to heart trouble? Let's connect the dots, starting right at the beginning with that initial infection.
So the condition we're talking about is called acute rheumatic fever, or ARF for short. Now here's the really wild part, and this is so important to get. ARF is not the strep infection. It's actually your body's own immune system kind of going haywire after the infection is gone. Now, many of the symptoms of ARF do eventually go away. But, and this is the big but, the one part of the body that might not recover is the heart. The inflammation can cause permanent scarring on the heart valves. And when that happens, it's a whole separate condition called rheumatic heart disease. Honestly, that is the lifelong damage we are so desperately trying to prevent.
So what is going on here? Why would your body suddenly turn on itself like that? Let's dive into the mechanics of this immune system mix-up.
Think of your immune system like a super smart security team. Its job is to find the bad guys, in this case, strep bacteria, and take them out. And it does. But then the job's supposed to be over, right? Well, in ARF, the signals get crossed. The security team gets confused and starts seeing its own people, your heart, your joints, your skin, as the enemy. And it just keeps attacking. That, in a nutshell, is what an autoimmune reaction is.
Now, it's really important to know this doesn't happen to everyone. The risk is highest for school-aged kids, between about 5 and 14 years old. It also seems to affect girls a bit more often than boys. And get this, there's even a genetic link. Some people are just born a little more prone to having this kind of reaction. And this, right here, is what makes the condition so incredibly tricky. The serious symptoms don't pop up right after the sore throat. Nope, there's this silent period, a delay of about 3 weeks where everything seems fine. And that original sore throat, it might have been so mild you just brushed it off as a cold, or maybe you didn't even notice it at all.
That delay, that is the hidden danger.
So, because of that sneaky delay, knowing the warning signs is absolutely critical. Let's look at the major symptoms that can show up when the real trouble finally starts.
Doctors are on the lookout for 5 key major signs. First is a really intense joint pain that actually moves around. One day it's a knee, the next an elbow. We are not talking about a minor ache. Second, and this is the most serious, is pancarditis, which is inflammation of the heart itself. Then you have these other really unique signs, little painless lumps under the skin, unusual jerky movements called chorea, and a very distinct ring-shaped rash.
Okay, so with all those possible symptoms floating around, how does a doctor know for sure what they're dealing with? Well, they don't guess. They use a very methodical checklist.
And this is it. It's called the Jones criteria. And you can almost think of it like a scorecard. It combines those major signs we just talked about with some minor ones, like a fever, or certain markers they can find at a blood test. What's pretty smart is that the requirements are actually stricter for people in low-risk populations. It's all about being incredibly precise to make sure the diagnosis is right.
So it all boils down to a clear, 2-step process. First, the doctor absolutely needs evidence that there was a strep infection recently. That's a must. Then, the patient has to meet the Jones criteria, either by having 2 of those major symptoms or 1 major symptom plus 2 minor ones. It's a straightforward, evidence-based formula.
Okay, after all of that serious stuff, here is the really, really good news. ARF is treatable, and even better, it's preventable. So let's talk about how we stop this thing dead in its tracks. As soon as ARF is diagnosed, the first order of business is to get rid of any strep bacteria that might still be hanging around. For that, penicillin is the hero drug. It's incredibly effective, and it can be as simple as a 10-day course of pills, or sometimes just one single powerful injection.
But really, treatment is great, but prevention is the ultimate prize, and it works in 2 ways. First, there's primary prevention. This is all about stopping ARF before it can even start, and all it takes is treating a strep throat with antibiotics within about 9 days. Then you have secondary prevention. This is for someone who has already had ARF, and it involves long-term antibiotics to make sure it never comes back to do more damage.
So if you take away only one thing from all of this, let it be this. We have the power to stop a serious, lifelong heart condition before it ever begins. And that prevention, it's as simple as getting a sore throat, especially in a child, properly diagnosed and treated. That simple step is everything.
So, we've seen how a simple infection can confuse the body's security system and lead to potentially permanent damage. Knowing all of that, what's the single most important step you can take? It's simply taking that sore throat seriously and getting medical advice. It's such a small action, but it's one that can protect a heart for a lifetime.